Hi, my name is Madison and I'll be your nurse today. The doctor wanted me to come in and talk to you a little bit about a medication he just prescribed for you called Haldol. It's also called haloperidol. You might have heard it. It's that. It is a conventional antipsychotic used to suppress some symptoms of schizophrenia which you've been exhibiting. It's typically dosed as 0.5 to 5 milligrams orally. So what we would do is we start you on the lowest dose and progress you up from there. Some side effects we should go over would be there's some anticholinergic effects associated with it. So what that means is there could be some dry mouth, constipation, urinary retention, blurred vision, things like that. So to help with those effects, we ask that you, or if you were to experience them, you would chew on some gum, create that saliva, suck on some hard candies, increase fluids and fibers in your diet for the constipation. Also, increasing exercise will help move things along down there. Some other things we should go over are, it's a syndrome called neuroleptic malignant syndrome. So if you were to experience anything such as a high fever, muscle rigidity, a loss of consciousness, anything like that, we would want you to call us immediately and let us know, and we would have you in and we'd go from there. We'd assess you and everything. There's also some muscle symptoms associated with it. So we could have some Parkinson-like symptoms, so tremors, muscle rigidity again, so stiffness of your limbs and arms, and so your arms and legs and everything. You can have an imbalanced coordination and gait, so while you're walking, just those sedation effects and things like that. We just want to be careful. We don't want you to operate any heavy machinery or drive or anything like that. If you do experience some drowsiness or dizziness or anything, so for this medication, we want you to take it at bedtime, just because it does present, cause some of that drowsiness. So we don't want you to have any daytime sedation or drowsiness or anything during the day when you should be up and moving. We ask that you move slowly from a lying to a standing position. If a quick movement of this can cause a drop in your blood pressure and cause some fall risks and everything. So we just want you to be careful with things like that. If you were to decide to stop taking this drug, we ask that you do not stop taking it abruptly. We would ask that you would call us and we can help you figure out how to taper the dose and go from there. It does cause some photosensitivity. So what this means is when you go outside, your eyes become sensitive to the light. So we would ask that you wear some sunglasses to protect your eyes from that, or a visor or a hat or anything just to protect your eyes. If you were to experience any allergic reactions, such as a rash or itching or anything like that, we would want you to call and let us know. So you can take this medication with food orally. It is available in other forms, but for you, we have been prescribed oral. So again, we'll start you on the lowest dose and see how that affects your symptoms and everything like that. I do have a handout for you, and we can go into more depth of some of these if you would like. Do you have any questions for me?